Good Friday afternoon. Thanks for joining us here at 3 o'clock on the Adventist Health Wellness Connection. We've got a lot to talk to you about today when it comes to injury management and prevention, and we're looking at people all the way across the spectrum of life, from the teenage athlete who's doing high school sports, maybe playing some football, all the way up to the weekend warriors, kind of like myself. Our hospital team plays soccer on Sundays, and I have done some nasty things to my knee before, thinking that I'm young. And unlike that song, we are young. I am not young anymore, so you can't be doing that kind of thing. Before we talk a little bit about the program at Adventist Health, I wanted to introduce some of our doctors, Dr. Jose Bosque and Dr. Anabia Udofia. Good afternoon to both of you guys. So first, Dr. Bosque, my understanding, right, is that you, in your training, worked with the San Antonio Spurs?
Yes, I did. I got a little opportunity to do that. That was fun. Before coming out here to Bakersfield, I got an opportunity to be on the medical staff with a couple different teams out in San Antonio, including the San Antonio Spurs, a couple of the college and the high school football teams. So it was a great experience. I really enjoyed it, and you know, I'd do it again if a situation popped up.
So you know your way around sports injuries. You've probably seen a lot in your time.
We've seen a lot of diversity from the professional to collegiate and high school.
All right, great. And Dr. Udofia just joining Adventist Health Bakersfield. So first and foremost, welcome to you. Thank you for joining the team.
Thank you so much.
Tell us a little about your immediate history. Right? You're immediately coming out of a fellowship with the Cleveland Clinic. Is that right?
Yes. So while I was at the Cleveland Clinic, I also did a sports medicine fellowship. And like Dr. Bosque, got a wide variety of athletic experience from high school football all the way up through professional. We covered the Cleveland Cavaliers as well as the Cleveland Indians. I like to say that I was there while LeBron was there, and we left, and
now he followed you here to California.
Now he followed me here to California. What can I say?
He must be knowing where he's going to get care. Maybe, I don't know. You know, that's fantastic. And I mean, Cleveland Clinic's one of the top programs in the country, I would imagine. I mean, you think Cleveland Clinic, you think Mayo Clinic, you think Johns Hopkins. Those are top programs, right? So, and what's it? I mean, maybe I ask both of you this. What's the difference? I mean, when you're going through training as an orthopedic surgeon, sports medicine, are there different specialties you can kind of go through in orthopedic surgery? So sports medicine is a specific one? Okay. So that means that you specifically look at sports injuries then?
Yes, so I specifically look at sports injuries, but your residency training prepares you to cover a wide variety of orthopedic topics. So we are experienced in trauma, in joint replacements, some of the hand and foot conditions that you would see, but the specialties allow you to kind of really get into your niche and find that groove where you make the best fit.
Oh, great. I mean, so you guys are the ones to talk to about hopefully not getting injured on the field. We'll talk a little bit about prevention in a little bit. Before we get to all that, though, we want to mention Adventist Health Bakersfield, the only A-graded hospital by Leapfrog, which is a nationally recognized program that looks at hospital quality. So this is a quality program, and when we're talking specifically about orthopedics, I'm going to go down the list and do a little bit of a humble brag here, but our orthopedic service is also specifically award-winning. We have received the Health Grades 5-star award for hip fracture treatment 7 years in a row, as well as the 5-star award for total knee replacement and clinical excellence. And Adventist Health Bakersfield also a Blue Distinction Center for both knee and hip replacement, as well as spine surgery. So that's a specific program out of a insurance company that looks at where we want to send our people that we are insuring to make sure that the best outcomes are had by the people that we're insuring. So that program is kind of a blue ribbon, if you will, right? On the program that you guys have. So you both have seen injuries from probably, as you guys mentioned, from the collegiate level, the pro athlete level to the not so pro athlete level. We want to talk about all the topics from prevention all the way to treatment, so everyone kind of has all these things in mind as they're going through sports-related injuries. Let's start with kind of the problem. When Dr. Udofia, when you talk about the problem, are people preparing themselves before they get into sports, be it at the professional level or even at the amateur level?
That's a great question. So part of the problem is there's a lot more people that want to be active at this point.
Active, which is good.
Which is good.
Yeah.
You know, and we definitely encourage that when you think about your long-term joint health and kind of keeping those aches and pains away. Having a exercise program going along with that is very important. But when you see like the participation levels in high school athletes, participation in our quote-unquote baby boomers, all of that is going up, and proportionally we see a lot more injuries going along with that. So
Okay.
people want to jump in and they don't necessarily know the proper techniques, so a proper warm-up or how to kind of keep their muscles active and limber, and so you see a lot of things that we weren't seeing before.
And high school athletics accounting for more than 2 million injuries every single year. So, I mean, part of the challenge is, like you're saying, there's more kids participating in these sports, but are they prepared? One of the interesting things I heard Dr. Buske most recently is a lot of injuries come from cheerleading, right? Cheerleading, of all things, we used to think, oh, it's just, you know, but they're doing these flips in the air and they're falling on the ground and doing things where they're breaking bones now.
Oh yeah, oh yeah. I mean, things, not, you know, not only in the commonly known as male sports, but also in female sports, we're seeing a lot more exercising, a lot more energy involved in a lot of these routines that they're doing. I mean, things are getting very competitive nowadays, and so as long as you can up the ante as far as the kind of activities you can do and competition, more energy means more
potential to break something
injury.
bad.
So.
Yeah, and overuse injuries are, I'm seeing this account for half of all the sports injuries. So it's not just breaking a bone, but it's pushing a little too hard,
Exactly.
a little too fast,
Exactly.
increasing your reps or whatever it is a little too much, being a little too ambitious.
Exactly.
So that's a huge problem, and it's a lasting problem. So what happens with these kids after they get a sports injury?
So if it's not properly managed, you can really have a problem long term. I see a lot of people that come in and they've got bad knees, and you ask them, well, did you injure it? And they're like, no. And then, well, actually, when I was playing football in high school, you know, I had this injury and I was out for a while, but I didn't really follow up. And then you see them now and they've got terrible arthritis.
Right.
So, you know, it's definitely something that can have a long-term impact if not properly treated.
And is this something like if you break a leg or injure a knee, you're going to see potentially down the road? Like, because a lot of people, you hear football injuries, right?
Sure.
Al Bundy, right?
Sure.
20 passes, touchdowns in one game against Taft, whatever that his saying is. But, you know, he's always talking about his football injury, and you hear guys talk about that. So this is something you live with lifelong after you have that injury and are prone to more injure it again, right?
Oh yeah, most definitely. I mean, if these things are not caught and treated appropriately, they can have a long-lasting effect. Like Dr. Duffy said, you know, anything from degenerate joints, which, you know, depending at the age level that you get, it can really have some really long-lasting effect and the quality of life in the future. You know, growth plates, fractures, you know, it can heal malunited, can really kind of put you in a course where, you know, you may have some deficits as you kind of continue to grow and continue to have your life.
And Dr. Udofio, why are injuries on the rise? What's happening?
So a lot of that has to do with, you know, in this climate that we live in, everyone is ultra competitive. So they want to start their kid. Everybody's kid is going to be the next Tom Brady. Everyone's kid is going to be the next Serena Williams, and they know that at the age of 2. So putting your kids in these sports and having them specialize in one specific sport too early is one thing where they have such a repetitive impact on a specific joint that they lead to these fatigue problems that they can have with their bones and their muscles. So that's a big part of it. And also the fact that they're practicing year-round, not giving themselves sufficient rest, and they're still growing. You know, kids, they're growing and they need a lot of sleep and a lot of rest to help keep growing, and we're kind of pushing them to the limits right now.
All right, so we're talking a lot about a risk, but there are things you can do to prevent that. Before we get to all of those kind of prevention things, which we're going to talk about in just a few seconds, I want to note that, again, we are streaming live here on Facebook, and I am following, as some of you guys are checking in, including Rita, Renee, and Maria all saying hi, and we want to say hi back to you.
Hi.
And while we're doing this, maybe we'll take a quick time out to just answer some of the questions. Some of them are kind of specific for some of these folks. Brandy is asking, do you know what I have? I have CPRS, and most doctors do not know. CPRS. What is CPRS?
It's known as complex regional pain syndrome. There's another name for it, RSD.
Okay.
Either way, it is kind of a tough situation. In orthopedics, we do seem to come across it quite a bit. Usually until someone injuring some part of their body, whether it be an ankle sprain, a fracture, even after surgery, we can see this type of problem. And basically, a situation where your nerves become like super nerves. You know, they get out of whack a little bit for whatever reason. We're not exactly sure why, but these nerves get really hypersensitive, and patients start experiencing symptoms of dramatic pain, limited range of motion, very difficult weight bearing, and so it's a problem that we do see. And it's an unfortunate problem because sometimes you think patients are going to go out and do well, and and for whatever reason they get the CRPS problem, and so then they kind of go through this process of trying to do the treatments, and you know, some people get better. Not everybody gets better, unfortunately. We're still kind of learning more about this problem, but definitely we got a couple tricks up our sleeve that we do for this problem. But yeah, definitely it's not a fun one for sure.
So Dr. Dove, what is there a treatment? It sounds like it's kind of a hard thing to treat.
It is a hard thing to treat. There are certain things that you can do with physical therapy where they can do different modalities. A lot of the times you'll see people, their extremity gets very swollen. That's effective. So you can do some different types of compression things, sometimes ultrasound, and different, it's called ionotherapy, where you can directly inject some different types of medications into the affected area and use different types of sonic waves over it. Can help lots of elevation, protecting it. So some people have noticed that if just even being brushed up against or hit can cause kind of a pain.
Wow.
So you want to just make sure, like if you're out, to kind of protect it so people aren't rubbing up against you, bumping you, and kind of just trying to take it easy.
Gotcha. Okay, and we have another question from Donna who says, do you administer Synvex for knee? I'm assuming knee pain.
Yes, there are certain indications for that. Typically you want to do that when people are showing beginning and moderate stages of osteoarthritis. Essentially, Synvisc is, we call it a gel injection. So when people have arthritic pain, you can do what you typically hear, those steroid shots, where you kind of try and calm down the inflammation. The Synvisc is a gel that's supposed to basically simulate the joint fluid. So we think of it more as a lubrication. So if you have that joint fluid and it's lubricating the joint as you move it, the idea is that you'll have less pain.
Interesting. Okay.
Synvisc is a name brand. There's different types. So depending on the location, but like Dr. Duffield mentioned, it's a good lubricating joint fluid for sure.
So it keeps the joint moving, basically.
Yeah.
It's like oiling your joints. I'm thinking of the Tin Man from
Yeah,
Wizard
pretty
of
much.
Oz. Again, we're answering some of your questions live here on this Facebook feed from our orthopedic surgeons at Adventist Health Bakersfield, but we want to get back to injury prevention. So, you know, I've got 2 kids. They play soccer. And I've heard different things of theories of whether you stretch before, stretch after. What are some of the things that you should do in order to prevent injury, Dr. Bosque?
Okay. Yeah, you know, that is a debate out there, especially in the sports literature, you know, where it's a dynamic stretching versus static stretching. I mean, ultimately, definitely ideal to get some kind of stretch in there. We're still kind of doing the studies out there to kind of figure out exactly what the right, what the right kind of stretching, but ideally it kind of makes sense, just like in with your car, you know, you want to warm it up a little bit before you kind of pull it in full speed. And so just like your body, you know, it's an amazing machine. And so ideally stretching really helps. Most people recommend doing what we call dynamic stretching, where you're moving, where you're doing stretches where you're kind of swinging and moving and kind of in a careful way, of course. And then after the game or the sport or the exercise, to do a good cool down, and that way you can kind of maintain the flexibility in your joints and your tendons and prevent potential future injury.
And Dr. Duffy, it's important to have a sports physical. I know that a lot of kids have sports physicals, but they don't necessarily go to an orthopedic surgeon. Do they need to see a specialist for any reason per se if they're having any kind of pain or any issues, or is that something a primary care doctor could handle?
So your primary care doctor can certainly handle that, certainly if they've already had an injury in the past, particularly if they've had surgery. You definitely want to go back to either the surgeon that did the surgery or an orthopedic surgeon to get that checked out to make sure that everything looks good before you go back. The importance of the physical is really to kind of rule out one of the big things that you hear is those athletes that just kind of pass out on the field. So getting a good physical before and taking good history has been shown to be actually the best way of kind of preventing that from happening and understanding the child's background and knowing what they're at risk of.
Okay, potentially sudden cardiac arrest, which is something that you could be screening for. Dr. Bosque, what about hydration, water? Big debate, Gatorade, water, a little bit of both?
You know, again, it's a debated issue. You know, depending which study you read will will tell you kind of which route to go. But either way, the main thing is hydration is very important, especially kind of in the county we live in, where heats are high. It's very important to hydrate yourself. You know, if you get to the point that before your activity, if you're thirsty already, you're really behind in your hydration. And so whether it's a fun pickup game or a big marathon race, I mean, hydration is key. Your body is very high percentage of water and basically runs on it. So it's something we always encourage.
Okay, what about strength training, right? You see a lot of folks doing CrossFit. I will personally admit I tried CrossFit for one day.
Don't tell an orthopedic surgeon that you're doing CrossFit.
I tried it, and you know, I will admit, and maybe I was doing the wrong form, my back hurt a little bit at the end of it. It's probably because I wasn't doing it right, but I feel like there was such a pressure to perform quickly that maybe the form, you know, and maybe, I mean, we're talking about doing a strength training program that's a little more structured is probably a little better idea.
Yeah, and so you definitely, technique is key. You know, you definitely can get some injuries there where you're trying to do the right thing, trying to get in shape, but you are kind of just throwing your body out of whack because you don't know how to properly lift. So if it's something where you're kind of getting into a new routine, definitely, you know, go to the gym, and you know, they always have those free personal training sessions that you can get, and it's helpful just to have them show you the machines, have them show you the right technique to do. Going back to our stretching, you definitely want to get a good warm-up in, maybe 5-10 minutes before, kind of warm up your muscles, get your heart going, and then you want to progressively increase the weight. Don't think, okay, I haven't lifted in 3 years, I'm going to go and do 200 pounds on the bench press. You know, you want to kind of ease into it, aim for about 2 to 3 times a week, and make sure that you're also adding some cardio in along with that. And
so maybe 10%, there's like a rule, right? Don't go crazy. Don't go from 100 pounds to 200 pounds the next week, right?
Exactly. Don't increase over 10%, you know. Don't think you're going to go from a 2-mile training to all of a sudden to a 4-mile training, okay? That's when injuries happen.
Yeah, and what about rehabilitation, Dr. Udofia? Should an athlete be supervised during workout sessions to prevent injuries, and how do you make sure that the rehabilitation happens properly?
Yeah, and especially when you think about kids, you know, they just kind of want to get out there and they haven't learned anything with technique or anything, so you definitely want to make sure that they're being supervised. A lot of times when they're participating with school activities, they're going to have the coach there, a trainer there that can kind of monitor them. But once they do get hurt, it is important to have somebody that's kind of watching that rehab and making sure that they're doing the right exercises to get themselves back to where they need to be. They're doing the proper stretching, you know, the icing that's needed, and they also have different types of treatments that they can do that aren't the lay person isn't going to be particularly savvy with. So it's definitely good to have them see, you know, the trainer. Sometimes you may want to enlist the help of a physical therapist because they have knowledge of movement in the body that other people don't have.
And Dr. Boski, how do you make the decision when you're talking to a student athlete or a collegiate athlete when they can go back to the game? How do you know when they're fully healed? I mean, you always say, you hear it like Derek Carr, right? You know, broke his tibia or fibula. How do you know? They always say, oh, he'll be back in 6 weeks. How do you know that, right? I mean, how do you figure that out? Yeah,
you know, a lot of it depends on the type of injury that occurred, whether it's a bony problem, a joint problem, ligament, tendon, you know, the variety, kind of spectrum there. Basically, when all said and done, ideally you want to get to a situation where you've got good protective support. So usually that includes things of having great range of motion, making sure you have good full range of motion. And then secondly, the other thing I look at is that they've got protective strengths. So good strengths, if they've been able to cut to the point where they're, you know, fully strengths. So with the good range of motion, good strengths, good flexibility, usually that's the time where you're ready to get back and hit the field.
And go slowly, is that right, Dr. Udofia? You were talking about doing a little bit of agility training, something that eases you back into, again, don't go back full throttle, right?
Don't go back full throttle, and before you go back, and that is where it comes into play, working with a trainer or a physical therapist, they should be able to put you through those sport-specific drills so that you can ensure that you're ready to go. So particularly, say, an injury like an ACL, where you need, that's for your cutting and your pivoting, you need to be able to demonstrate that you can do those same motions that you would be doing in your basketball game and your volleyball before you get back out there and try and do it, because you don't want the risk of re-injuring.
Gotcha. And overuse is considered one of the forms of injuring, I know that if you run a lot, like I try and run occasionally, I started getting like shingle, what do you call those? Not shingles. Shin splints. Shin splints, that's what it is. Shingles is a whole other story. I'll probably get that later on in life. Shin splints, that's an overuse injury, right?
Yep. Mm-hmm.
Oh, yeah.
So how, I mean, it's just basically pushing it too far too quickly?
Mm-hmm. And really just doing too much. And you'll kind of see that when you have pain that kind of increases with your activity, something that comes and goes, it's really centered around the activity. You kind of find if you're a parent and you're looking at your kid, they start to complain about not really being motivated to go work out. They're kind of running away from their workouts, feeling kind of burnt out is something that you can also see. So that mental fatigue is also a sign of overuse, and that's a key thing not to overlook.
Gotcha. And from the athlete's perspective, if you have pain that continues and won't go away, or like the shin splints, right? Every time you run, that's an overuse injury.
Yeah.
Right.
Oh, yeah,
if you keep doing the same thing over and over again, and it's still hurting, that's probably a bad sign. And these are some of the other things, right? If you can't perform at the level that you used to be able to perform at, right? If you can't run as fast, or you're kind of hobbling along, or your technique suffers. If you, again, keeping the same form as you're supposed to be doing if you're lifting weights and you can't hold that in the right form, that's probably a big problem, right?
That's right.
And so that's a sign for you as an athlete, that you should go see a doctor?
Yeah, that's definitely a sign, because these are things that if we catch early, we can fix early, you know. If things are kind of lingering left aside, it can lead to further damage, and sometimes irreversible.
Wow. Okay. And Dr. Udofa, from a parent's perspective, how would you know that if your kid is possibly injured, but they keep playing through, which a lot of high school football players probably try and do, right?
Oh, they absolutely try to do. You kind of look at them. So when they come back from practice, are they hobbling more than normal? They may tell you, "Oh, I'm fine." But I feel like parents, especially moms, you tend to know when something's going on. They may complain, they'll get up and go, but they may like, yeah, you know, I really wish I could have the day off. Or, you know, one thing to pay attention is when they start increasing their activity. So we'll use football for an example, but right at the beginning of the season when you're trying to get in shape and you're doing your 2-a-days and your extra conditioning, that's a time to really kind of pay attention, because that's a peak time when your kid is going to have an overuse injury. So kind of watching how they behave, what they're complaining about. If they start to grumble more than normal, you see them limping, they say, "Mom, you know, where's that Motrin?" Or, you know, "Can you grab me some ice?" Things like that. You know, even if they say, "Oh, I'm fine," they may really not be fine.
And so that's from a parent's perspective. What about from a coach's perspective? What Dr. Boske might a coach see potentially? I mean, they're going to hear from the student athlete probably some of the same things, I would imagine, right?
Yeah. I mean, from a coach's perspective, things that they would look into is, you know, is the performance of the athlete gone down? You know, are we seeing trends? You know, trends is a big important thing as well. And it depends specific per sport. You know, if you think about in baseball, you know, pitchers, you know, is their speed going down in their pitch? You know, are they not able to make those special pitches like as good as they could? Or in running sports, you know, is there behind in time? So these are things that coaching kind of, you know, they're with the athlete every day, training with them. They're probably the closest one with the athlete, knowing exactly from an outside-in perspective.
Okay, and again, we want to take a quick note that we're doing this live here on Facebook. So if you have questions, Brandy's been asking some questions, some other folks have been asking questions about their injuries and things they've been wondering about with orthopedics and their sports injuries. Ask along with us here, and we'll try and answer them as we go along. Let's get into one of the most common types of injuries, and this is the ACL injury, which we hear a lot about. So, Dr. Boske, what exactly is an ACL injury?
Oh, yes. ACL stands for the anterior cruciate ligament. The ACL is a ligament inside your knee. It helps with support of your knee. It prevents your knee from wanting to shift anteriorly or even pivot. And so it's a very common injury that we see athletes injure, and so it's kind of a big topic of discussion in the sports world.
And so, Dr. Udofa, who's most common to get this type of injury? Is it football? Is it soccer? Tennis? I don't know.
You can. So pretty much anyone that has cutting, pivoting, or change of direction in their sport. So let's say, for example, you will see it in football, but you'd probably see it more so in a running back than you would in who's trying to, you know, juke a a defender than you would see in an offensive lineman.
Okay.
Or you definitely see it in soccer. You can see them in basketball when people try and pivot. And interestingly enough, you may not even see it in a sport at all. Somebody might, step awkwardly, fall down the stairs, and there you go. But typically it is something that's associated with sports.
And I noticed in that graphic we're just looking at, women are more likely to get it. Why is that?
So there's a lot of theories as to there's a lot of theories as to why, and we're still not quite sure. Some of it has to do with thoughts about possibly different hormones, like the estrogen effect. Women tend to have wider hips. It kind of affects the way they stand. Also, when we do jumping sports and land, women tend to engage just their quads, whereas guys engage their quads and their hamstrings, and it kind of affects the jump forces kind of across the knee are affected. So there's also some thought about the size of women's knees, and the smaller size of their knee leads to less space for the ACL. So there's lots of different theories as to why, and nobody's really quite sure what it is.
Does shoe choice play a factor at all in this?
Not in that, no.
Not in that, okay. And Dr. Boski, maybe you can say, we're going to actually put a graphic up that shows what exactly is going on. How is the injury taking place? I mean, maybe you can explain this. We're looking at the front of a knee, basically, right? With the kneecap removed is what it looks like?
Yeah, like we talked about, there's a couple different ways of injuring it, but the most common way that we tend to associate it with a non-contact pivot injury, and usually it entails the athlete's body moving in one direction while the foot is planted in the other direction, causing this pivoting kind of twisting mechanism where the knee, basically the ligament is kind of maxed out at the length and just kind of tears in its entirety.
Okay, that's no bueno. So what do we do now that we're injured? I've heard this before, rice. Is that the only thing that you can do for this, or is this a surgical case potentially?
For most people, this is going to be a surgical case. If
Okay.
you were out there playing a sport and you want to get back to that sport, you're going to need surgery to do it. There are some exceptions, running straight ahead, biking, skiing. You can get by without an ACL, and sometimes, depending on your activity level, if you're older, you may not want to go through that surgery. But our high school athletes in particular that are out there, they're going to definitely want to get that fixed. So it's important to come in and see us as quickly as possible, so we can get that evaluated. Usually we can tell by exam you may need, but we'll like to confirm with an MRI, also to make sure, see what else might be going on in the knee, any other injuries that can happen. So you definitely want to get seen and kind of get that process going.
And then you'll be up with your feet up and rest, ice, compression, elevation, the RICE acronym, as we like to say. But Dr. Boski, what is exactly involved in repairing it? Are you detaching something back that ripped? Or, no?
That's a good question. It's a good choice of word.
Okay.
We can define it between repair and reconstruct.
Okay.
It is pretty rare to have that you can repair an ACL. Usually it gets so destroyed that it's not something that you can repair. And so we go to what we call reconstruct. And basically what that means is that we borrow a tendon, usually from either somewhere from your body or from a donated tissue, and use that tendon to reconstruct a ligament in your body. And with time, what your body does, it kind of reconverts it to your own ligament. And so that's basically the gist of it. Is unfortunately not everyone can be repaired, but luckily we've got pretty good ways of reconstructing and making your body recreate a new ligament out of something else.
It's like a nylon rope that just splinters, and you can't go back there and try and sew it all back together.
Big old spaghetti,
so you're going in there basically cutting it out and putting a new one and
exactly. And nowadays we do this mostly arthroscopically, and having pretty good results with it.
Okay, so it's not a major, you're not opening up the whole knee and everything. You're able to do it with the scope. So let's talk about, I think the next one is a labrum tear. That sounds bad. What exactly is a labrum tear, Dr. Udofia?
So you think of the labrum as kind of like the shock absorber of the shoulder. So the shoulder is basically, you think of it like a golf ball on a tee. So the labrum kind of goes around the golf ball and kind of helps it really sit on that tee and keep it centered in place. You'll see a labrum tear a lot of times. You see, we saw the picture of the pitcher, that motion where you're coming back and kind of cocking back like this, and it goes all the way around your shoulder, and you can tear it in the front and the back, just kind of depending on the position of your shoulder at the time of injury. So it can be a pretty difficult problem to manage, especially if there's some bone involvement at the time. But yeah, it's something baseball players, you'll see it, volleyball players, your linemen. So anyone that's kind of standing like this and they get jammed up and they get driven back, you can see it in them as well.
So what's the repair for that?
Well, yeah, you know, if you choose to get it repaired, nowadays, again, we're pretty advanced and we're able to do, majority of the cases, majority are able to do this arthroscopically. On a rare occasion, we do have to do an open type of procedure. But for the most part, we can try to handle this through an arthroscopic approach. We try to basically put the labrum right back on the bone anatomically where it lives, usually with a combination of sutures and anchors, and basically preparing the site of injury so that the body can do the remainder of the healing.
Okay, so you're just putting it back where it goes.
Pretty much putting it back and it goes, yeah.
So that it can grow back, essentially.
Exactly.
Heat illness, Dr. Uduffy's big issue here in Kern County. Yeah. We have a huge issue with, we have farm workers that are out there who get heat stroke and get sick from working, and just general. I mean, construction workers, it's not limited to even one profession. So for student athletes, especially that are out there doing football practice or something outside, soccer practice, what are the risks with heat illness and heat injury?
So you kind of have to think of it along a broad spectrum. So when you think about those high school athletes, what they're really most of the time are going to come in complaining of are the cramps. So they get dehydrated and their muscles start to cramp up. But unfortunately, if you kind of ignore that, each step is kind of a warning sign.
Okay.
You know, like, hey, the body isn't regulating its temperature the way it should. You need to check in and kind of do what you need to do, be it hydration, getting into cooler temperatures, taking off some clothing to help your body with that evaporation process and cooling down.
So that you're not getting, and there are different things, right? There's heat exhaustion, heat stroke, and then there's cramps. So maybe Dr. Bosi, you can walk us through the difference of what these different things are. I mean, if you're having, which is the most serious, I guess, is the first question.
Well, heat stroke would be the most serious. Okay. That's a very serious and emergent situation for sure.
So you'd have to go to the emergency room potentially for that.
Exactly.
But I mean, you can get cramps, right, working out, and the heat, and that is that a dehydration issue for the most part?
It can be. It can be. It could be electrolyte imbalance. It could be just all sorts of things, but mainly either not enough fluid, electrolyte imbalance, or just lack of use of the of the muscle itself.
Could be cramps just in overusing. Let's talk about
one thing I will just say about the heat stroke being the most serious one. The thing that differentiates that from any other type of heat illness injury is people are going to be confused. They're not going to be themselves. They may not know where they are, and that's really a get them to the hospital type situation.
It's not we're going to cool you down right here on the sideline.
Yeah.
Let's talk about weekend warriors, because that's another big topic. I will raise my hand and say I'm one of them. I guess we should probably define a weekend warrior. Can you be in your 20s and be a weekend warrior? I'm always thinking the old guys, kind of like me. I put myself in that age category. People that are going out on the weekend doing things they probably shouldn't be doing. Is that right?
Yeah. So when you think of weekend warrior, you do tend to think of older, just because life. So you've got your job, you come home, you have your kids, and there just isn't time to really kind of get out there and get that pickup basketball game that you used to do when you were in your 20s. So you could be in your 20s and be a weekend warrior if you're essentially only trying to get your exercise in on the weekends.
On the weekend, one day.
We recommend you try and get your 30 minutes of exercise every day. If you're trying to cram them all into the that Saturday, Sunday, you're a weekend warrior.
You're a weekend warrior. What kind of injuries? I'm sure you've seen plenty. Your share of those folks who've come in and said, "Oh, I was reaching up and playing tennis, and that's when you get the shoulder issue or whatever it is."
Yeah, tendon pathology, tendon injuries tend to be a very common weekend warrior, whether it be from basically just tendonitis to a complete and full thickness type of tear. So that's a very common type of injury for sure. Joints are very commonly injured. And then we see ligaments as well. We kind of just a little bit about what they see on.
Yeah, and Dr. Duffy, I mean, the majority of these things could be prevented, right?
Yeah, it's similar to kind of what we tell our younger athletes, where having routine is key, proper technique is key, and really going through that spectrum of making sure you're appropriately warmed up, you're going through the progression of your routine and then cooling down. I think a big thing with the weekend warriors is you like to think you're 20, but you're not. You know, so you can't just go out there and run the 15 miles that you used to do.
And you were talking about heart health too, and Dr. Wesley, that's important too, because you hear about people collapsing out on the field. Cardiovascular health is also a big part of this too, right?
Oh yeah, most definitely. That's why we always encourage getting a good physical examination, get your heart evaluated, because it's a sad thing. You know, these are things that we can sometimes pick up before they, you know, can lead to demise. And so, and that's one area. The other area is as you get older, you know, and our lifestyle of coronary artery disease and the meals that we eat, you know, we do encourage an active lifestyle, but definitely always, like Dr. Udolfia mentioned, is, you know, trying to do it more on a regular basis so that you can prevent that whole weekend warrior type of problem.
So what can you do cardiovascular-wise to set yourself up so that you don't injure yourself on the weekend?
So you definitely want to try and get, you know, 2 to 3 workouts a week in. And you have your maximum heart rate and your target heart rate. So for cardio, you don't want to go out there and, you know, be pushing it so hard that you're passing out.
Sprinting.
So your maximum heart rate, a rough estimate is going to be 220 minus your age.
Okay.
That's the max that you should ever see when you're out there on the bike or on the elliptical and you're looking at that, you know, they say grab the handlebars and it spits out that number. That's the max you want to see. So take about 80-85% of that, and that kind of tells you where you want to be over the course of your 20-30 minute workout.
And then strength training is another big deal, right? I mean, we talked about it being important for the young athlete, but probably for the older athlete as well.
Oh yes, most definitely. Especially when it comes to joints. You know, a way to offload your joints is by maintaining a good fitness and strength with your muscles. You can imagine it's basically creating an internal brace. You know, many people use brace for injuries, as they know it provides some support. Well, maintaining a good fitness, maintaining your muscles strong, basically offloads the joint to the point where you're more functional and less pain.
And Dr. Udolfia, flexibility too. We're talking about stretching.
Oh,
It
yeah.
goes back to that as well, right?
Yeah, so definitely. So a lot of times when you can kind of think of our bodies as a rubber band. And as you get older, you know how after a while you pick up that rubber band and instead of it kind of being springy, it kind of snaps. So it's important to realize that as you get older, your muscles are essentially like that rubber band. It's easier for them to just kind of to snap. So you want to make sure you're doing the proper stretching and maintaining that flexibility so that as you're doing things, you don't just have that kind of tear, but you have more of that pliability, so you know your body can adapt.
So that's the flexibility is key. All right. And
one thing I wanted to share was you know, we always encourage, you know, at least 30 minutes a day, maybe 20, 30 minutes a day out there. But you know, some of the studies show that, you know, you can't make an excuse that you don't have 30 minutes, because some of the studies are actually showing that if you divide it even in 10-minute intervals, 10 minutes in the morning, 10 in the middle of the day, 10, you know, it shows that patients, heart health-wise and just their overall fitness, actually gain as much benefit from doing that as well. So if you need to disperse it, 10 minutes here, 10 minutes there, 10 minutes in the evening, I mean, you actually will see longevity.
Getting up and walking. They say sitting is the new smoking. That's what I heard from a cardiologist just recently. So common weekend warrior injuries, Achilles tendon rupture. That also sounds pretty bad.
Oh yeah,
Oh yeah, it's painful. I mean, you imagine if it's happening to athletes, it's going to definitely happen to, you know, who are well trained, well stretched out. You know, it's going to definitely happen to that weekend warrior. And so, it's an injury. It's kind of funny. Most patients, when it occurs,
that does not look good.
Find as if someone kicked them in the back of their leg.
Yeah.
You know, it's a very common complaint. Or they're walking, and they feel like someone shot the back of their leg. You know, and then all of a sudden they notice they can't move around.
Can you lift your foot anymore?
Yeah, you know, you could.
You can't flex
do that.
it.
Yeah, you can dorsiflex it, but you can't plantar flex it, and that's where they start missing the problem.
Okay, and because it looked literally like you normally see that band in the back of your
contour and
foot,
it's gone.
And when it's gone, it looked literally like kind of like a you know, it was, wow, it's almost like a can there. So when that happens, so the most common is middle-aged obese male, and you were saying feeling like you got kicked really hard. So or you feel like a pop. Is that another surgical case, I would imagine?
It depends on what your goals are. If you want to get back there out on the basketball court and you're going to need that push-off power, you probably want to go ahead and get it fixed. But, you know, surgery for this specific injury is not without its complications. There's not good blood supply back there, so wound healing can be a problem.
Okay.
So we do have studies out there that have shown that an aggressive rehab protocol can be just as effective as surgery. So it's an individualized plan for each patient depending on your risk profile and your goals, and then we can, you know, guide you as to whether surgery or not is the best option for you.
So it'll grow back essentially, or?
It'll have to be fixed.
It'll have to be fixed.
So, you're saying if you don't do surgery,
Right.
it doesn't grow back per se, but it can scar in a fashion that is functional for you.
Gotcha. It doesn't reattach per se, but it just
Yeah.
kind of stays in place. This is the one you hear about all the time, tennis elbow. Dr. Bosco, what is tennis elbow exactly?
Well, tennis elbow is one of those tendon problems again.
Okay.
It's an overuse, common overuse injury. Again, middle-aged males, females, all equal. It's called tennis elbow because it's commonly found in racket or type of sports, tennis. Basically, it's when you experience pain on the outside part of your elbow. Usually, difficulty with extending your wrist, gripping things, lots of strengths, but really the problem is when people come to me is when they're just having this bad pain right here on the side of the elbow and they just can't get rid of it, and it's really limiting their lifestyle.
So that's a use thing. So don't use it as much. I mean, that's what they always say. I'm gonna go back to the old joke, right? The doctor says.
Well, you know, it's funny. It's a microdegenerative problem in the tendon. You know, it's just a microscopic tearing in the tendon as we age and we overuse our tendons and we don't strengthen and keep that flexibility. These little microscopic tears occur, and unfortunately, they don't heal back like normal tissue. They heal in more of a scar fashion, and so now your other fibers are having to make up for what you lost, and if you're not, you know, maintaining that fitness, you start experiencing some of these symptoms.
So rest. Stop using it?
Rest, stop using it, you know, get evaluated. A lot of times with these overuse injuries, and particularly with the tennis elbow, a good physical therapy regimen. This is when our physical therapy partners can really be good at giving you stretches to strengthen the area, show you good technique to be using, because a lot of this, you know, if you're doing the same thing 100 times in the wrong way, it's going to really bother you. There's different braces that you can use. Occasionally you may want to even get an injection in the area. So there's lots of different things that we can offer that aren't just don't use it.
Okay.
Certainly we want you to continue to use it, but we want to help you use it the right way.
The right way. Okay. Next one, picture of Kobe. Rotator cuff. So what's going on there, Dr. Bosque?
All right. Well, your rotator cuff, again, another type of tendon. You actually have 4 tendons that we call the rotator cuff muscle that all come together to create a cuff of tissue over your shoulder. And the function of the rotator cuff tendons are to keep your shoulder stable and allow you to elevate it. And so this is an injury that can happen mainly with overhead type of sports. Baseball players, basketball players, very common injury. Now, in regards to the weekend warrior, you know, believe it or not, this is something we see a lot in our office, and it's not necessarily the athlete that gets this problem. Yeah. So if you're not an athlete and you're getting this problem, don't feel bad, because we see it a lot in the non-athlete as well.
Just stretching for the vegetable can?
Yeah. So,
just reaching in the back of the car.
Wow.
Yeah.
Is this a surgical case, or is this something that may not necessarily be a surgical case?
Doesn't necessarily have to involve surgery. The vast majority, especially because you typically tend to see it over the age of 40, and the vast majority, we like to say probably about 80–85% of these can be managed non-surgically. If it's something where it's an acute injury, you come in like, you know, I was playing tennis and I felt something in my shoulder, and ever since then, you know, that's something where, yes, we want to go in and get it fixed, and studies have shown that acute injury, it's better to fix it. But a lot of times these are going to be those overuse, repetitive motion things over time, and when you have that over time kind of more degenerative type process going on, that tends to really respond well to non-operative treatment.
Okay. Meniscus tear. That's the knee, right? I'm thinking.
That's the knee.
Okay,
the
the
knee.
knee.
That's the knee.
I remember my high school anatomy class. So meniscus tear. That's the meniscus. Is the thing in between your knee? Is it the pad?
Yeah,
Okay.
it's a specialized cartilage. It's kind of like the shock absorber of your knee. You know, it's basically the function of it. And
how do you tear that? I mean, I'm looking at like a thing of like a sandwich and like the two things between the bone. How do you go about tearing that?
Usually,
hard to do.
Usually it's a twisting type of maneuver. You know, not only twisting, but a lot of time where your knee's in a very flexed position and you create a twist. Very common. Now bear in mind again, a lot of these injuries, while it does happen to the athletes, do happen to non-athletes, and so we see a variety of tears ranging from the acute tear that happens from an athlete twisting, but we also occasionally see it in the non-athletic community, and that's, you know, the joint space narrows down. And that could be from someone who was a very active athlete when younger and not so active now. The joint space narrows, causing the shock absorber to take a little bit more of that absorption. So we start seeing a little bit of degenerate tearing there as well. So it's we see a kind of a wide variety of type of injuries.
So it could be something that sudden onset, or it could be something that kind of comes on as time goes on. And they're going to feel like a sharp pain in the knee, essentially? Yeah,
you know, the meniscus is one of those things where you can feel all different kinds of things. You know, sometimes you tend to say people will kind of feel it. They'll complain around their joint line. Sometimes they'll say I have pain in the back of the knee, but they will also have. So you can sometimes see swelling, especially if there's arthritis involved. You can see where it comes and goes. If it's a flap tear and you have a piece that's kind of floating around, you may say, wow, I can't straighten my knee out anymore. Or if I do this and my knee locks up and it gets stuck, and that's that. And that can also be the meniscus. So there's a lot of different things that people can come in complaining about.
And what's the fix?
Depends. Again, all of these are, it depends, and you know, we like to be very patient specific with these things and really understand your goals. It can, a lot of times, if it's that degenerative over time type tear, can be treated without surgery. But if it's something where it's limiting your range of motion, where people come in and they're saying, my knee is stuck, my knee gets locked. You know, those are things where that's you probably have a piece flapping around, and that's not going to go away.
Jamming up your knee, essentially.
Yeah, essentially, without surgery.
Okay, so lots of different injuries. Well, we've kind of covered the gambit here today. Dr. Bosque, any final words for those weekend warriors and high school students out there? I mean, we got a lot, I know, of high school football players right now who are playing Friday night. In fact, they're playing probably in about an hour, 2 hours right now. You know, any last thoughts or recommendations for those kids? I mean, if they've got a nagging injury or potentially, when do they need to come see an orthopedic specialist? Or do they have to go to their primary care doctor first, or do they just come in and see you?
You know, that's a good question. A lot of that final question, you know, a lot of it relies obviously on the insurance, what they allow them to do, whether if they need to get a referral first from their primary care doctor. But definitely when they start seeing an injury that continues to be something that's lingering, something that's not going away, particularly more concerning things that I see are if I see a lot of swelling in the joint. That's something they want, especially the young person, you know, you really shouldn't have much swelling inside your joint. If that's going on, you know, that's telling you something's going on that's not right, you know, and that would quickly get that evaluated.
Do these things necessarily have to be career-ending injuries at a young age? Is it better to get it treated now, or do you kind of have a wait-and-see approach depending on the student athlete?
So I think fortunately the good thing is a lot of these things, if we catch them early, can be something that we can treat without surgery, and people can go back to their activities, their athletic careers, you know, whether it's high school or beyond, and be very productive with that. So the important thing is try not to ignore. Certainly, you know, there's a certain level of, okay, you're going to work out and you're going to have some soreness, but you know, really kind of pay attention to what your body's telling you. Don't ignore some of those signs, and you know, getting in and being seen and treated promptly can really kind of prevent things from blowing up later on in life.
So you're not Al Bundy talking about your knee injury when you're,
you're
50, 60, 70 years old.
That's right.
Well, thank you guys both for answering all these questions. And again, we'll continue to follow all these questions. If you have a question you'd like to talk to Dr. Bosque or Dr. Udofia about in person, you can give them a call over the clinic. 661-716-9410. Again, 9410. You can find us on our webpage as well, ahbakersfield.org. And we want to thank you, and of course, Dr. Bosque, for your time, and Dr. Udofio, welcome again to the Adventist Health family, and for joining us here in Bakersfield. It's great to have your expertise and your specialty care here in Kern County, both of you. I mean, you're quite an asset to our community, so thank you both.
Appreciate it.
Thank you.
All right, and thank you guys for watching us here on Facebook Live. You're on 23 ABC. Until the next time, we'll see you again.
All right, thank you.